Donut, what is the best medication to stop sexual needs or wants? My son is doing things that I feel can put him in a dangerous situation, and I was wondering if there is a medication that could help with this.
Yeah, that's a great question. And there are most of the antidepressants, class names Zoloft, Prozac, Paxil, these medicines that have been on the market for quite a long time to treat depression. One of the biggest and most common side effects is actual lowered libido and sexual drive. Often we're trying to limit that when we're trying to treat depression, as people are trying to connect emotionally or physically with their loved ones. But in cases where sexual drive is putting people into dangerous situations, or if it's in psychiatry, we use the term ego dystonic, where their thoughts or their wants or desires make them feel bad about themselves, we can use the side effect of antidepressants to try and treat some of those behaviors. So thinking about paraphilias and these kind of things, also used a lot in sex, love, and porn addictions. Antidepressants can be used. Typically, it's dose dependent. And so if patients don't respond to a low dose, don't think that it's not going to help. They should get to max dose really that's standard. Yeah, I would say antidepressants being first line, and then some type of potential concurring therapy to discuss what the impulses are, what the internal drivers are, if the loved one can participate in something like that.
Awesome. Thank you. Real quick, before we move on, we see all your comments and questions coming in like the live stream and on Facebook, and we're getting texts of all your guys' questions. We are going to try to address them, but our time is so limited. So just to let you know, we're seeing them. We're not ignoring them, but we will try to do our very best to get to your questions. Duffy, my wife has told me that she is frustrated because she mentally tires easily. Is there anything I can do to help her?
Yeah, it's really common in Huntington's disease. I think about it as you're fighting it all the time. And you're constantly trying to overcome these barriers that Huntington's disease has laid in front of you. And whether that's emotional barriers, cognitive or thinking barriers, physical barriers, it's all this barriers of disability that you have to rally against and try to overcome. And so when you're thinking about, gosh, I got to make decisions or problem solve or take in the external stimuli and the environment that's going on, it's exhausting because it's constantly effortful. Most of us don't even think about it, right? We get up, we go to the bathroom, we make 5 decisions along the way, we organize something, we get a text, we make a decision. Oh, let me look up that recipe for dinner quickly. And we don't even think about it. It's just natural. But every single one of those steps is effort. And if you think about that way, you can understand like that's exhausting even thinking about, let alone living. And so I think whoever's asking this question is 10 steps ahead of themselves, and that you're already really aware of how tiring it is. You're hearing her say how tiring it is, and you're appreciating it, valuing it, and acknowledging it. So with that, you're empowered. You're empowered to say, I hear you, I see you, I understand you. Let's navigate this. And oftentimes it's trying to decompress that mental burden as I think about it. So trying to offset, making the environment as predictable as possible, decompressing it so you're not overloading someone with external stimuli or have to-dos, right? Keep the week simple, keep the days simple, keep them predictable, really map out your week. Know that on Tuesdays and Thursdays, you go to the grocery store. Sundays, maybe it's church for you. Wednesdays is your Starbucks coffee outing. And then you get breaks in between, and that there's rest times where you get to go away into your kind of private zone, whatever that is, either stare out the window, watch TV, listen to the radio, listen to music, whatever, wherever your loved one finds respite or solace, right? Just like all of us have little zones that we feel like we can just decompress in, and make sure that those are part of your daily routine. Take off multiple decisions, like what's for dinner? Pizza or eggplant? 2 decisions, not 5, because that's overwhelming, right? or mapping out the week in advance. So you're not waking up and feeling like, what do you feel like doing today? And then that just feels super overwhelming. Like we talked about social interactions. You're not having a group of people come over, but hey, Betty, who used to work with is coming over for half an hour just to chat and have a cup of tea. So working with your loved one to say, what are the things that you enjoy? What are things that are overwhelming? How can we decompress that from you and from your mental load? And it's a fluid state as I think about it. What works today and this week might not work next week or the month from now, right? Because we kind of change. So being a little bit flexible with that to meet the loved one's needs in the moment.
Thank you.
And I think I would just try to talk to her about she's frustrated by it. It's not her fault. Unfortunately, this is part of having Huntington's disease, that it's common for all of us, like Dr. Duffy said, to get frustrated because we're not at the top of our game. Part of the frustration is probably because this person was usually prior able to do all those things that Dr. Duffy talked about and not get tired necessarily from it, and was able to manage it, whereas now they get tired from it. And that's okay. That's a natural progression. That's going to happen with aging in the general population anyways. Just normalizing it. It is frustrating, but let's figure out some plans to help. As I like to say, it's the more you can get someone on autopilot, the less their brain has to work as hard for those little things every day. What day do I shower? What day is laundry day? Just like Sasha was talking about. The more you can allow their brain to be on autopilot, then they can have more what I call brain energy to be in social situations that maybe they previously enjoyed and not be overwhelmed because they weren't overwhelmed with just getting through the day and their daily tasks. So
Good point. Absolutely. Thank you. Dr. Duffy, how much fluid does someone with HD require?
These are conversations that, again, we just had yesterday in our caffeine and fluids and all this. Excuse me, I'm getting over a cold, so excuse the cough. So there's no perfect answer there. They haven't zeroed in like HD patients need more or less than other human beings. They say drink 8 glasses of water, right? That's your standard number of glasses to drink. So again, just like the caffeine, everything within reason. HD patients tend to either drink way too little water, which is actually more common, or way too much water because of that more impulsive, perseverative, or fix ideas on doing something. So there is danger in drinking too much water. It can cause electrolyte abnormalities that can be very severe. And we've seen people end up in the hospital with this. So there is definitely too much, which is an odd thing to think about in terms of water, because we think water is good for us. So if we drink more, it should be better. But in fact, too much is too much. So I would say if you anchor yourself in 8 glasses of water is the standard recommendations within reason, that's your ballpark, right? And it's hard to remember to drink water for HD people. It's sometimes hard to drink, like physically drink water because of choking and coughing. You need to find the perfect water bottle. Oftentimes it's a nice mug with a straw makes things easier for people to drink because they keep their head fixated right here. They take an allotted amount of water and they're not trying to coordinate a bunch of muscles as they're tipping their head back. So I say find a really cool water bottle. And if that means it's got your sports team on it, or if you just decorate it with all the stickers that you're into, or it's got the sparkles that you like, claim it, own it. This is your water bottle. And you carry it around with you. And that means either the patient with Huntington's disease or the loved one brings it along with them. So it's a constant reminder that you should be drinking water. Sometimes even these water bottles keep track of how much you're drinking, and that can be helpful. And you can keep a running track on whether it be on the refrigerator or whatever works for you. That can be helpful as a reminder, because it's hard to think, how much water did I actually have? And if you're checking it off, sometimes that can be helpful as well. We all need to stay hydrated. I need to drink more water. I'm sure everybody else that I'm looking at could drink more water. This is not just HD patients. I call it just being human. So do your best to drink kind of your targeted around 8-ish glasses of water a day. And if you get pretty close, good for you. That's great. And again, too much can be too much. So all within reason, pick your battles, but having it right in front of you reminders, even not even saying anything. If you see the water bottle on the side and your loved one's sitting right there, you can just hand it to them and don't say anything. And automatically what we think about is we're handed something to drink, we take a sip, right? And they might just put it back down again, and doing that a few times a day or a bunch of times a day, you'll find your rhythm or your system with it. So I call it little tips and tricks.
No, that's great. I was just gonna say on your having a cup thing, something we found, because my brother has unlimited amount of spills. Iron flask
Yeah.
is one that we have found that is really truly, when you knock it over, you have a count of 20 to pick it up before it spills. And even then it's probably not, because his is thickened, but the straw has a wrap around it so that you have to actually push it in. The straw doesn't come flying out and then spilling. So it's just iron flask, Amazon.
Perfect.